a retreat and oral health training for all ICOH staff in Jos Plateau State. That's why we're here. And it's, ICOH is Inter-Country Center for Oral Health for Africa. But we had a public hearing last week on Tuesday, which we had in Abuja. And the public hearing is going to make ICOH to become RCOT, the Regional Center for Oral Health for Africa. It's a regional center because there are 6 in the world. And this is the only one that is meant for Africa. And the law has not been passed for the past 30 years. So we're lucky this time around. The law has passed the first reading, second reading, and the public hearing. So we're now waiting for committee report to go to the third reading National Assembly.
When it is passed, what is the expectation?
The expectation is that the Regional Center for Oral Health is actually a baby of WHO. Because in 1962, there was an agreement with Nigeria and WHO. And in 1979, they had a meeting also in Paris. That African delegates that were there in Paris requested for Africa to have its own, because we have ones in the Malaysias, in Europe, we have in the other continents, in Americas and all that. So Africa does not have a regional center for oral health. But now WHO has given the mandate to establish at that time. But luckily for us, in 1988, Professor Luko Ransome-Kuti, Minister of Health at that time, got the approval of WHO to establish it. So the center was established in Jos, but because it's a military regime, they gave it a fiat, executive fiat, to have it as ICOH. So but now we have to have a legal backing, a legal framework for it to establish. So WHO has signed an MOU that it should be a regional center for oral health for Africa, so to become RCOT.
What are the core mandates of the center?
Well, the core mandate from the name, like you said, Regional Center for Oral Health Research and Training. So there's going to be a research and training institute for all aspects of oral health: periodontitis, caries, NOMA, oral manifestation of HIV/AIDS, or of course, maxillofacial injuries. These are the core mandates, and the focus is to improve on the health indices as regards oral health, so we can have better oral health for Nigerians and Africa. And these countries that are part of it with MOU, they are called WHO member African countries, and they are 46 in number. So that means all oral health research, epidemiological survey, statistics, training of dental officers, and oral health stakeholders can be done in any part of these countries and in Nigeria.
Sometimes research is not our major problem,
yes,
but implementation. What assurance will you give the Nigerians and Africa by extension?
Okay.
That this time around we'll have it, we'll have different approach.
Okay, well that's why we have the Center for Training. That's why we're organizing training. We're going to have an African training in April. We are going to understand and understudy the problems of implementation, because in any research we have a lot of researches, but we have to have a focus whereby we can activate those researches and become reality. That means we look at the factors that prevent this. So WHO will give us all the support, and the federal government of Nigeria through Ministry of Health are giving us all the support to do it, especially in NOMA. That's why this NOMA disease that we have in Sokoto in particular, we are going to collaborate with them.
Let's find out what is the major oral challenge in Nigeria at present.
The major oral challenges in Nigeria at present is training. So luckily for us, we are now having universities for training of oral health oral health professionals. Because in the past, we used to have oral health institutions that are basically in the south of Nigeria. Now we're having oral health institutions like in Kano and Maiduguri, so that we can be training people in dentistry, dental health technicians, dental therapists, oral health professionals, because people don't know that there's a marked research and cases of oral health. So but at least now this is an awareness. So gradually we are going to move forward.
Let me ask you one question.
Yes.
What is the general landscape, the field? What is the statistics like in terms of the oral health problems among Nigerians? Are we in a dangerous situation? Are we in an alarming situation? Or is it just routine like other? What is the statistics in terms of victims of this disease?
And that's why the last NOMA day that was held in Abuja, the Minister of Health, the Honorable Minister of Health specifically said there was no statistics on NOMA. He said it because we need to coordinate our statistics if they are there. So we need to know the alarming situations. Because we see patients in cancer, oral cancers, we see them in tumors, we see them fractures. Like the alarming rate is based on what we know. So we are trying to bring it out to reality now, because that's why the minister said we should give us a mandate to coordinate and publish the statistics. And you know we must have those facts correct, because this is WHO center. So that's why I cannot give you figures now, because this is a media. Those figures will come in due course, because we have them and we're going to do the final statistics and show them, but they are in alarming rate, to be honest, because we have diseases that are actually affecting our populace. So we need to expand on them.
So what is the challenges and achievements so far of the center?
Well, like I said, my name is Dr. Sani Balarabi. I was appointed last year, June, as Director CEO of the center. The center has been in existence, like I told you, because the limitation the center had: one, funding; two, there's no legal framework backing it. So it's just been part of existence. But now, if you have a legal framework backing it, people will collaborate with you, because the law is that all other countries, or the 46 member countries, should have a relationship with us so we can go forward. So, but now the achievement now is that we have improved on our budget, we have improved on our personnel. Our personnel are now working hard, their morale is boosted, and they are happy, and they are ready to assist us. And of course, we are going to expand on that in the future. And we're also thinking of how, if the law is passed, we're going to have it. Remember, the head office is in Jos. We have a Jos permanent site, we have a Jos city center, and we're going to also have liaison office in Abuja and in 6 regional centers, and of course in African countries. So we make things easy. WHO has promised to give us a platform to go ahead and develop.
What is the purpose for this workshop, and like how many staff?
So like I said, the purpose of the workshop, we are going to have many trainings. So the training was that to first of all bring the staff, because most of them need to understand what they are, because it's been 30 years we don't have the law. So the purpose of the training is to bring them out from the working environment, less tense environment, come to a relaxed environment, and share how each department, we have about 4 departments: Department of Basic Sciences and Research, Public Health, Finance and Account, and we're going to expand to have more departments. So each one of them will know which role they will play. So the purpose of the training is like awareness for the staff. For a center that's training people, you must have your staff also well trained, so that you understand the basis of training. That's the first aim of the training.
How many staff are participating?
All the staffs. Because I made it in such a way that all the staff that are key staff that are important in the center must all be present. So all the staff are participating.